what's actually happening to the brain with these repeat injuries. Every time a fighter gets hurt, that brain takes a real neurometabolic hit. On a cellular level, the actual neurons are in a damaged state, and it takes a lot of time for recovery to really happen. They're not the same person that they were. We see emotion, difficulty sometimes. We see personality changes. Of course, you'll see in the ring, typically, especially toward the end of careers, that reaction times change, and that can be a subtle thing. But the reality is, especially in combat sports, small changes in things like reaction time mean big differences in outcomes in competition.
Dr. Yomi, thanks for coming on the podcast.
Absolutely, glad to be here.
Why are repetitive concussions or brain injuries so devastating to the brain?
And the answer to that lies in what's actually happening to the brain with these repeat injuries. Every time a fighter gets hurt, that brain takes a real neurometabolic hit. On a cellular level, the actual neurons are in a damaged state, and it takes a lot of time for recovery to really happen. What typically happens is a fighter will get back to competition, and the brain may or may not be completely recovered from the previous injury. You can imagine if there's already damage there and you go in and cause repeat damage to a system that's already compromised, what you end up with is over time compounding damage to the system. And, eventually a fighter will notice it, some sooner, some later. And if they don't seek the right kind of intervention, that damage accumulates. And we see it all the time in sort of late stage athletes that they're not the same person that they were. We see emotion, difficulty sometimes. We see personality changes. Of course, you'll see in the ring, typically, especially toward the end of careers, that reaction times change. And that can be a subtle thing. But the reality is, especially in combat sports, small changes in things like reaction time mean big differences in outcomes in competition.
Yeah, that actually leads very well to my next question because they call a concussion a mild TBI. We know that's not the case. What are some of the functional consequences? Can you elaborate on that more
Yeah.
that you've
Yeah.
seen?
Well, the thing to understand here is that definition of a mild TBI or traumatic brain injury, it's a legacy term that comes from something called the GCS, the Glasgow Coma Score that we use in medicine. Really, what we're scoring is someone who at the worst is completely comatose, right? Completely non-responsive. That is kind of a very, very, from a GCS standpoint, someone who's is very impaired. And so compared to that, the injury that we're seeing from somebody with a mild TBI is just that mild. But for the actual athlete, the consequences are serious, right? That TBI means that the brain is compromised. Okay, what we're seeing is that system that needs to function in an optimal capacity in order to compete at the highest level is impaired, to a level that they might not be able to operate even for activities of daily life. You'll see oftentimes guys with headaches, they're not able to concentrate, there's changes that they're seeing. And so, the real functional reality is that these injuries can be quite significant.
What are some of the ways to mitigate that? Because these guys are going to be going back in. I mean, that's
Yeah.
their job. And
Yeah.
so their job is to fight, or if you're in the NFL, it's to get back in the game.
Yeah.
What are some ways to mitigate that from the short-term perspective and long-term perspective?
Sure. That's an excellent question. I think this comes down to some gatekeeping and guardrails, and then some things that the athlete themselves is going to be responsible for. As far as the gatekeeping and guardrails, that's where the medical side of things comes in. This is where I'm passionate. I'm a ringside physician. I take care of athletes. I'm seeing them, before, after weigh-ins. I'm seeing them, during the match. I'm watching every single second. I'm the first person to see them when they step outside of the ring or the cage. And that assessment is really the core of maintaining safety. We're supposed to really evaluate these athletes yearly with a very, very focused physical exam, figuring out what's going on, where they're at, and comparing. And this is key, comparing to how they used to be. I'll be honest, this is a place where I think a lot of growth. There's a lot of space for growth in amateur sports and even on the professional level. You'll find that behind the scenes, tracking these athletes' health over time is something that isn't quite at the level you would expect. Me and my team are actually trying to work on a project right now. It's called Ringside Network to try to track the healthcare of these athletes over time. Track the injuries that happen because we have protocols to try to avoid an injured athlete coming back into the ring. We have suspensions after a concussion. Oftentimes, is a mandatory suspension that can be anywhere from 45 days to 180 days, or even longer if they've had multiple injuries in the past. And that's a start, but doesn't quite capture the specifics of an individual fighter's injury and tracking of how they're doing. Repeat exams. Hey, how did he look a week later? How did he look a month later? In sports medicine, we have something called return to play protocol. What happens is immediately after the event, you go on complete rest, cognitive rest, and physical rest. Pretty quickly, we like to see athletes go back to sort of physical activity, mild, meaning take a walk in a garden kind of thing. And then from there, you progressively add on activities. And what we recommend is if let's say you start reading a book, for example, at week, let's say 2, and then you start getting a headache. Well, you take a step back. You take a step back and you pare it down to what your brain is able to actually to tolerate. And the whole idea here is that we're trying to allow for the brain to fully heal, right? And so that's the medical kind of side, and the guardrails, these rules and regulations are meant to be guardrails for the athlete. So that's that side, but the athlete also has their own sort of responsibility here. And I think we can break that down into 2 different parts. Number one is how can you do things that are protective against injury, right? And, there's great research for things like creatine, which are providing, ATP. We can kind of go into details about why that's important for an injured brain if you'd like to. But things like that are neuroprotective, strategies that are neuroprotective will put you in the best possible position before competition and everything else that surrounds that, right? Injuries happen even in sparring in the gyms all the time, right? So that's number one. The second thing is, what do you do to truly fully recover, right? And I know this is an area that you're passionate about because, a system to actually get a fighter, their individual, brain to continually get that function back to an optimal state, that's something that's a little more rare to find. You need someone who understands the neurometabolic side, who understands the medical side, and who understands the athlete competition side of things and what it really means to be a competitive athlete. And, finding people who are passionate about all those things is the reason why, people like you, I think, are kind of, you're picked, you're the wheat from the chaff kind of situation.
For like the people who may not be competitive athletes and just general brain health stuff, how is the role of neuroplasticity meant for you in the way that you help people, but also maybe give some tidbits on how the average person could apply that to their life?
Yeah, neuroplasticity is the idea that our brains and specifically the connections between our neurons are directly affected by our day-to-day activities. And the things that we do constantly become habits. And those habits are really reflective of all of those neuronal connections truly being rewired. And so what that means is that for all of us, you have the ability to, through your day-to-day activities and things that you build into habits, truly rewire your brain. You can upgrade your brain. Lots of people, into biohack and all this, and it's like,
Yeah.
well, your brain's built to do this, right? You just have to put into place the practices to make that happen. Right. And it can be anything. It could be someone who, your job requires you to, really, really put together a lot of different pieces and be creative. Right. And so you make it a habit to actually explore that creative side of your brain and train those connective, abilities. Right. It can be somebody who, has to be, get into the ring and, and slug it out and be in that, that optimal state, that flow state. And there are things that you can do to train the brain in order to get better at those things. For me, I can think back to college where it was back in my pre-med days, things like math and physics, and organic chemistry, things where I had to memorize massive amounts of information, be a fast calculator. And, I would do mental math all the time. I was lucky enough to learn kind of young that that's a little bit of a cheat code.
Mm-hmm.
And what I mean by mental math, if for anyone watching or listening to this, you just close your eyes. If I ask you to do 2 plus 2, you pretty much automatically come up with a 4. But if I ask you to do 88 divided by 12, you see how you need to do an extra step there? All right, you got to put a lot of the older folks out there. We probably learned to put one number on top, another number on underneath that, and then a little line there, right? Or maybe the little symbol with the
Yeah.
one number here, another. And you're moving these numbers around based on the operations, right? And that act of in your brain moving those numbers around and keeping them consistent in your brain in order to do that, that act is literally training your brain to be better at these operations, right? And so it's it sounds, pretty simple when we kind of point it out like that.
Yeah.
But it's things like that put into sequence and into practice that will piece by piece improve your mental function, you know. And I'd love to hear more from you, Doctor, about what you put into practice here, to get some of these athletes, to where they want to be.
Yeah, like really at a simple level is just getting challenging them cognitively. Mostly, I think, in terms of the brain's frontal cortex, because that plays such a vital role. And as you know, that's the number one area to get damaged because it's the most exposed. So often you're going to see things like issues, like, as you meant, like with math or issues focusing, decision making. And so things like the Stroop test, these ancient things that multitasking or even things like juggling can be very helpful and beneficial, help people concentrate. But even more on like a holistic level, I'm so much about visualization and meditation,
Hmm.
affirmations, because we know the brain responds to that very well over time.
Right. I agree 100%. Yeah, I think you're
And
right on
how
the
about
money.
for yourself? I'm super curious to dive in on some of your
Yeah.
favorite ways to challenge
Yeah.
people.
Yeah, I'm typically kind of first contact for these things. I'm seeing fighters immediately after the injury and typically just setting up these guardrails and usually referring them to people to do this sort of therapy. That typically is where I'm at, with athletes. So I tend to defer that sort of thing, and that's kind of part
Yeah.
of the reason why I like having these conversations. Um,
Absolutely. I mean, but people, what you're doing is equally as important because of the safety aspect and being able. We need medical doctors like you that are trained that are like, is it actually safe for this person to get back? Because we know it's
yeah.
such a dangerous sport.
Yeah, yeah, and that's I couldn't agree more. And I think one of the biggest things with that, and this is an area that I think there are active conversations, is we have to be able to take a look at this fighter, this athlete, because it could be multiple sports, longitudinally, meaning what does this person look like today? What do they look like in a week, in a month? Sure, an injury happens. What do they look like coming back? And compare those things, right? And that's where a lot of pieces are missing currently, right? Even at the level of, say, the UFC, we've seen some pretty, serious injuries even here recently. And even though those athletes do have access to probably some of the best medical care in the world, that longitudinal aspect still can be difficult to establish, right? And so this is where I think, in terms of moving into the future, there's a lot of room for improvement and growth, okay? Is being able to look at these athletes and truly say, okay, from a neurometabolic standpoint, where are they?
Hmm.
Compared to where they've been, and hopefully be able to say, all right, this person actually has healed, truly healed, or that we've been able to overcome certain levels of damage that they had before and see true improvement, right? True markers of someone being safe to be back in competition, rather than just saying, well, it's been 180 days, like suspension's over, head
Right.
back.
Yeah, yeah, it's really important, especially because of the devastating, as everybody is aware of now, the devastating long-term consequences that could happen. I wanted to dive a little bit into your history and your background and what ended up motivating you to go through something as rigorous as medical school and now to be working with professional athletes. Sounds
Yeah.
like an amazing journey.
Yeah, I count myself lucky for sure. I think my journey has been one that is fueled by passion. Everything that I do currently is are things that I'm passionate about. I was that kid even when I was very, very young who said I wanted to be a doctor when I grew up. Didn't know what kind, just knew I wanted to be a doctor. Later on, I was an athlete, in high school. My main sport was football. Also did some wrestling, mainly to stay in shape in the off season. And I got hurt. Pretty bad knee injury, needed some surgeries. I was completely out of play. I was at a place where, I was young enough to think like, hey, like I can make it professional and, and not think, hey, does that make sense? Like,
Yeah, yeah.
and naive enough to really, really put it out there. And that's probably a character, trait for me is just, whatever I'm doing, I'm pretty serious about it. But after the injury, a lot of things kind of went a different way. I went from, potentially looking at colleges and, hey, can I get into this program, that program, to how do I learn how to walk again?
Mm.
And then will I ever get back on the field at all? And during that time period, I actually met some sports medicine physicians, people who were kind of involved with my care. And I saw for the first time, hey, here's a way to practice medicine that's pretty cool. You get to, be involved with sports, but you're also kind of doing the medical side. And, of course, it's you're a doctor, so
Hmm.
you're fully into the science. And I thought, man, that is a really, really interesting way to be a doctor and be in the field. And that kind of was my first inspiration. Later on, I kind of learned more what my particular strengths are. Um, it happens that I'm great at presentation and that plays well with social media. I had a blog and that kind of grew into kind of a social media presence and the communication aspect, really taking these topics, these complex medical and scientific topics and breaking them down in a way that is digestible for kind of the everyday person or people who want to learn more and maybe never had a chance to.
Hmm.
I think I'm able to connect that and I kind of enjoy doing it. I really enjoy doing it.
Yeah.
So that aspect kind of came in as well. And during my residency training, I had some great doctors who kind of opened the doors for me. Dr. Alexander Rogers in Los Angeles, California, in particular, brought me to my first USA boxing event, and I got to watch him do it. People like Dr. Shepard, also here in Southern California, with the California Association of Mixed Martial Arts. These are people who kind of showed me what it was to be a ringside doctor. I was like, hey, this is a really cool, cool little niche. I love taking care of the athletes. I love the community that's around combat sports in particular. A lot of people may not see what is behind the scenes. I mean, a lot of people that get famous in the ring, the story doesn't end after the ring.
Right.
After that, they transition to other things. You see guys going into refereeing and going into judging. They open gyms. They start foundations, and really in a lot of ways that's where the community behind all this comes from. And to me the community probably is the most important part. Not to get too much into off track from the medical science side, but from a society standpoint, combat sports and the discipline that comes with that, especially for young guys, young men, being able to have that discipline, being able to learn the fact that you can put in time, effort, and discipline and have an outcome, a victory, and standing in that winning kind of of space
Yeah.
is a huge, huge lesson. And for a lot of kids, it turns the trajectory of their lives. For me, football was that, right? The fact that organized violence was actually a way for me to productively use that kind of instinct, it changed my entire approach. I learned that instinct can be directed toward a positive, productive activity, and that's a core lesson, I think for a lot of kids, and it's just such a great way to build men, and women. We have plenty of women in the sports too, and especially now, it's really growing on that side, and the community that comes around that. I feel honored to be a part of for sure. So that's how I got here, and things are going really well. I love it.
Great to hear that. Thank you for sharing. And got a kind of a oddball question for you because you seem like a traditional medical doctor, but that also thinks of the body in an integrative way. Can you walk us through,
Yeah.
I don't know what it's like to be in medical school. I have a PhD, but I'm not a medical doctor. How have you been able to take the traditional medical understanding, but and kind of mix it into an integrative route that you talk about?
That was a shift that came of necessity. I mentioned the injury I had, the knee injury. The doctors got me back on my feet. Obviously, the orthopedics, the sports medicine got me to where I even got back on the football field. But I did have chronic pain. I was at a place, I think, in my late 20s or my early 20s, where I couldn't even walk up a flight of stairs without pain. I'm sitting here looking at this like, all right, so I'm 20. I can't get up a flight of stairs. What does 40 look like? What does
Yeah.
50 look like? What does this life look like? Of course, went to the traditional routes, went to different doctors, and things kind of go a certain way when you have pain like that. It's like
Right.
physical therapy to strengthen the surrounding joints and ligaments, which is a very solid way to start. If that's not effective, all right, now we start getting into pain medications. If that doesn't work, now we get into joint injections. And joint injections are very useful, but there, especially when we talk about corticosteroids, there's long-term damage. So for a young person, you have to take that into account. And
Hmm.
once you get to that level and those things aren't solving the problem, there's kind of this gap where really it's just surgery if that's appropriate or not. That's really the only question, unfortunately, that is going to be asked in the clinic.
Right.
And right there I could kind of see that, okay, if I'm if I'm going to solve this problem, I have to really 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 double down on finding every possible solution that I can. And for me, that meant that I really dove into the clinical science, the clinical research science, the purely bench science, and tried to find solutions for myself. I was patient zero, right? And through that journey, I went through many things that people are hearing about now. You hear about peptides and you hear about different therapies, cryotherapies, all these sorts of things, and learning that that sort of integrative approach is truly how I was able to heal myself, right? And so getting to zero knee pain for me was kind of my first entree into the fact that yes, we do have a very advanced medical system. We can perform miracles, particularly for people who are at a point where intervention prevents death.
Hmm.
We perform miracles in that space. But in the space of optimization of health, meaning taking someone who's at a place where things just aren't as good as they could be and getting them to where things are as good as they possibly could be,
Right.
that's where there's a little bit of a gap, right?
Hmm.
And I mean, thankfully there are so many companies. I work with companies now, that this is what we do. We focus on optimizing hormone health. We focus on optimizing joint health, right? It's all optimization, and it requires, stepping outside of some of those, traditional, oh well, let's just give you this script and let's just give you this surgery, and looking at other approaches.
Well said. I think it's a lot of flexible thinking because on one end, you'd be completely insane to say if you got shot out in the streets, that you wouldn't want to be taken care
Yeah.
of with that acute medical care. But at the same time, also acknowledging the short points of where it falls short in the long-term health. So I wanted to ask you about Dynamo Health and
Yeah.
what is the mission behind all of that
Yeah.
for
So
you?
Dynamo Health comes out of this passion to actually drive optimized health. My dream is to have a clinic where, yes, we're able to take, your common health concerns, but we're also able to take people in who are interested in being in the best possible shape mentally, physically, emotionally, spiritually, and we're able to support them with clinically backed science and with somebody like myself and similar people who want to do this type of medicine, right? And I want you to be able to see me and we talk about, hey, how are you feeling? How can we get you to feel better? Where's your joint health? How can we get that better? Really putting you as the whole person in a setting where we can figure out what pieces do we need to put in place to get you to be the best possible version of yourself. You know, for a lot of people, that means they just need a consultation with me. I'm reviewing things that they're often doing with multiple different specialists and oftentimes giving kind of a second look at, hey, like, what did this lab mean? Very oftentimes people go into the clinic and it's like, oh, it's fine, there's no problem. And what the doctor means is that there's no problem that warrants immediate intervention in order to cure or treat a disease state, which is valid. But what they didn't say was, well, these labs actually indicate that you're in the very early stages of a process that will, in 5 to 10 years, lead to a disease state, right? Maybe there's not even time to have that discussion sometimes, right? And so oftentimes it's just that, just literally consulting on that and second look on labs, second look on treatment plans, what could work. Hey, yeah, that surgery is an option, but here's a couple other options that are out there that maybe based on what you're doing as an athlete and you need certain movements to be intact and maybe you don't want certain scar tissue, maybe this other treatment might work best for you. Sometimes it's me having to physically, administer treatments. I do joint injections. I'm a joint injection specialist, and so that angle can come in. And we're building and growing right here in Southern California, and we're going to be, offering these treatments for anyone out there, and that means anyone who's active and interested in optimizing their health. I don't care if you're a weekend warrior, you're someone who just hits the gym and wants to stay in shape, or you're an elite athlete or an Olympian. We're here for everybody.
When it comes to like the spectrum of longevity and like kind of the new tide that we're turning as humans, I get fascinated by this. There's this guy, I don't know if you know of him, Dr. Sinclair from
Yeah.
Harvard,
Yeah. Yeah.
and he talks about that aging is kind of a metabolic, physiological, biological, quote unquote problem. His words, not mine.
Mhm.
Um, in that it's possible to reverse aging. I just want to know, with
Yeah.
your background, what are your thoughts on that?
Yeah. So that was a passion area for me even in grad school. I studied the biology of aging way back in 2014, 2015 time period. And it was super taboo at that time to suggest even that aging was a disease process. But even diving into the science at that point, I was convinced that really truly, when you look at the markers of aging, and the more that we have understood from a genetic standpoint, epigenetic standpoint, from a neurometabolic standpoint, all of these different standpoints, this is a probably the most complex disease process. And I know that's still a controversial statement. We haven't reached a place where we can make that official diagnosis. I think recent changes that we're seeing on a regulatory standpoint are opening up possibility to do that. But I do think that we've reached a place now in medical science where, yes, it's a complex metabolic process, extremely complex, but it's not infinitely complex, right? We're at a place now where we can actually really truly delineate all of this. And so it makes, to me, natural sense to say, all right, well, let's define that as what we're seeing. And the next, of course, question is, since it's a disease process, are there treatments and interventions that we can implement in order to augment that process or ultimately arrest that process, right? And don't get me wrong, I'm not a holy grail chaser here. I'm not
Yeah,
looking for the elixir of immortality. I don't
yeah.
know if that's possible. What I do know is that human beings are having longer and longer healthy lifespans, right? I don't think the maximum lifespan of humans has changed much. We've been able to do a lot by taking care of a lot of childhood and infant mortality, and that's kind of bumped up the life expectancy, right? But that's just an average. In terms of the maximum, number of years, it's been around 120 to 100, 120, that kind of range. That's always been the case, but guess what? We have a huge number of people who are now living into their 60s, 70s, 80s compared to the past. And the question is, what do those years look like? Do those years look like doctor appointment after doctor appointment and, a list of medications that's, a foot long? Do they look like, just a decline and, and essentially a slow suffering process? Or do they look like spending time with your kids and your grandkids and maybe even your great grandkids? Do they look like continuing to be out in the world, exploring everything that life has to offer as you get to stages in life where you're able to, experience life in different ways than you would have when you were younger? You
Hmm.
know, what do they look like? And I think that if, as we address this question of the process of aging and interventions, we're able to offer people higher quality of life. And that to me is where it's at. Doesn't matter if you have 60, 70, 80, 120 years. Let's make those quality years, right? And I think that's the true gift of both the optimization space and the types of physicians who are interested in this space and what they end up offering to their patients.
I couldn't agree more. As you mentioned, what you felt like walking up those stairs in your 20s. And, I had a similar TBI in my 20s. I felt like kind of like an old man at that time. I couldn't think clearly. Brain was foggy, body was hurting. And now, I'm 37 years old and I felt better than I did when I'm 25. So I think that kind of talks about what you're talking about there.
Yeah, yeah, absolutely. I find it interesting that you're a similar kind of case where you had your own experience, and I'm sure going through that and seeing what treatment options were available and where you were at, where you're feeling probably affected your own career trajectory as well.
Yeah, 100%. I mean, I look back upon it, and that head injury was ironically one of the best things that happened to me because it got me onto a new night life path and gave me this idea of neuroplasticity and that my life was not fixed and I didn't have a broken brain. And then not only that, could I get it better? Could I get it even better? Right?
Hmm.
And still,
Hmm.
I'm still fascinated with that on a day-to-day basis. So my
Yeah.
question for you are, life is a lot about principles, right? There's maybe like 5 to 10 principles on how to build a house, 5 to 10
Hmm.
principles on how to swing a baseball bat. What would you say are like the five number one principles for good brain and nervous system health?
Number one, keep in mind that your brain is part of the body. There's a misnomer I think out there that, hey, my brain feels this way, but my body is this other thing, right? The same way that you think about going to the gym for your body, think about going to the gym for your brain. Your brain needs to be trained as well. Okay. And cognitive habits are just as important as making sure that you hit the gym 3 times a week. So that's number one. The brain is part of the body. On the second sort of principle, it's just very much related to the first, is nutrition. The way I tell it to patients these days is your food is your medicine. Your food is your medicine.
Mm.
Okay. Everything that you're putting into your body is going to affect what you're able to do with that body.
Mhm.
Your body is made up literally of the things that you put into it. And so if you're feeding your body, you know, processed foods and, you know, the wrong kinds of calories, not giving it hydration, not exposing it to sunlight, which we know we need, not giving it the sleep that it needs, then the outcome that you're going to get is going to be a poor health state. But if you're eating, if you're making sure that every calorie that you're getting has maximum nutrient content, if you're making sure that your sleep quality is as excellent as it could be, making sure that you're moving your body, you're getting out into nature, making sure that you have a good community around you, that you
Mhm.
have people around you who are supporting you and who you can support, right? And you're in that positive loop as opposed to those negative loops that people can get into in the wrong environments with the wrong people around them. If you're doing those things, and guess what? You're going to be happy. You're going to be healthy. You're going to be able to get on podcasts and have conversations with Dr. Brody Miller. Everything's going to be is going to come together, and it's not magic. Very very straightforward stuff. And in this day and age, there's plenty of people you can go to who can tell you what's what because it never changes. It's always the same story. So that's number two. This that nutrition part of it. And the third thing I think is just discipline. Discipline is the most important skill because you don't actually have to be some, uniquely genius, gifted, talented individual in order to make things happen. The difference is usually discipline. Are you able to take a look at your goal, define it, break it down into steps, and figure out what are the constituent steps, meaning the small day-to-day tasks that are going to be able to bring you to that goal eventually, and just knock them out one by one, right? And if your goal is to improve your health, the first step is figuring out, hey, what does that look like? What does optimal brain health, for example, look like? Put it all out. What do I need to do? Break it down, and then day by day, you put it together and you get there. So those would be my top three principles for sure.
Fantastic. I would love to kind of wrap this up with maybe a few case studies that you've seen or remarkable outcomes.
Yeah.
But perhaps we can even talk about, and you don't have to give names, maybe something that was kind of devastating to see.
Probably the thing to focus on, and this is a pattern that we're seeing in combat sports in general, is that a lot of these athletes, as they're getting through their career, there's cumulative damage that kind of is building up. And typically, what we're seeing, like let's take UFC athletes for example,
Hmm.
we're seeing people who start out one way, and then years down the line, they're a different sort of athlete. And the general public sees it as well. They're kind of just they got old. They kind of got burned out. They could kind of pass their prime. But I don't think that that's exactly what's going on. I think what's happening is people are having compounding neurologic damage over time. And I don't think that enough is being done to mitigate that damage over time, right? I don't think that enough focus is being put on actually trying to get that brain healing. And a
Hmm.
lot of the things you're talking about here, I think, are super important for that. What do we do to actually continuously improve brain function, right?
Hmm.
And I think we are letting these athletes kind of go down this pathway to this kind of end result that doesn't necessarily have to happen, right? And to me, it's unfortunate because, these are, amazing people that just to be able to compete at that level is already, kind of like one in a million sort of individual. And then to
Hmm.
do it and be successful and be world class at it for like an extended period of time, that's like, we're getting into, truly rarefied air. And I think we should be doing everything we can to preserve function in people like that, right? And so that's what I'd focus on here is I think the next stage of from the medical standpoint here is trying to preserve the cognitive health for these athletes.
Yeah, yeah, I couldn't agree more because there's the resources are there in a lot of cases to be able to mitigate that or even reverse that. So yeah, thank you very much for sharing that. Uh, Last question is, what would you say to somebody who has experienced a brain injury, concussion, or even like a neurological setback like ADHD, OCD, or maybe even is on the autistic spectrum, and they're kind of down in the dirts, and
Yeah.
they used to be like sharp, but a lot of things, a lot of stress has happened, and maybe they're not quite there. What is some encouraging things that you might tell those individuals?
The first thing is don't feel like your condition defines you. It's very easy for people who have an obvious visual injury, like, hey, I broke my arm, to understand that, my arm's broke, but I'm okay, But when it's an injury in the brain, meaning, you mentioned some of these things like ADHD, autism, when these things that aren't obvious visually as injuries are harder to not see as your fault and kind of like, you as a person. And so I always tell people like separate those things out. You're not this condition, okay? And number two is there is always hope to improve. I'm not saying that this will at some point never be a part of your life again. That may or may not be the case realistically, but that doesn't mean that you can't get better, that things can improve. There's always pieces that can be put into place to make things better. And knowing that that's a possibility and that as I think can help people because it's like, well, you're not, this isn't like some life sentence where there's no way out. There are things for you to there's a lot of learning that has to take place. There's a lot of times it takes a lot of patience, and it takes time as well. But these are things that you can work on that can improve. And there are plenty of success stories out there, people who you would never guess that were in your exact same shoes, who were able to get out of it and make, huge strides and are in a completely different place. And you can be in the same place in the future. Just put the tools together, get it done.
Fantastic. Lastly, where can listeners reach out to you and find you and all of
Yeah.
your wonderful content?
Yeah, absolutely. So people can find me on social media. I am Dr. Dynamo, Doctor Dynamo. I'm on Instagram, YouTube. Our YouTube channel is Dr. Dynamo at Dynamo Health. You can also go to my website at dynamo.health. Or if you're involved in boxing or UFC, MMA style fighting, mixed martial arts in general, if you're a promoter, a physician, medical student, even, or a resident, anyone who's interested in that space, then definitely check out ringsidenetwork.org. We bring together qualified medical with promoters and events, and we're building out that space to try to help do exactly what I talked about here, track athlete health and help this community to keep moving into the future. I just want to say thank you for bringing me on here. I love talking to people who are passionate in this space. I think that the passion is the first thing. When you're passionate, you're able to bring together all the tools that are available and present them in a way that you can actually change lives and make a difference. So that's number one. I want to say, keep doing what you're doing, and let's keep growing together. Thanks for having me.